Welcome to Glioblastoma, aka GBM, a podcast brought to you by the Glioblastoma Research Organization, highlighting stories of GBM warriors, caregivers, medical advisors, and more. Welcome to Season 3 of our podcast, where we delve deep into the world of glioblastoma, also known as GBM. Join us as we navigate the complexities of glioblastoma with expert insights and heartfelt narratives. Please remember that the information presented in this podcast is for educational and informational purposes only. It is not intended to treat, diagnose, or prevent any disease, and you should contact your medical provider or healthcare team with any questions. Novacure is pleased to support the Glioblastoma, aka GBM podcast. Novacure strives to extend survival in some of the most aggressive forms of cancer through the development and commercialization of their innovative therapy called Tumor Treating Fields. Novacure partners with the Glioblastoma Research Organization to work together on behalf of patients and their loved ones impacted by GBM. To learn more, visit novacure.com. Dr. Betsy Grunch, welcome to the Glioblastoma, aka GBM podcast. I am so excited to have you on the podcast today to talk about your practice as a woman in neurosurgery, as a neurosurgeon, and to talk about this super unique approach that I feel like you've taken to bringing medical information to the masses through social media. So thank you so much for joining me.
Thanks for having me this morning.
Absolutely. I would love for those who don't know who you are to kind of just give a brief explanation of like who you are, your background, and I know, the practice that you currently are running.
So my name is Betsy Grunch, obviously. I'm a board certified neurosurgeon. I've been in private practice neurosurgery in a town outside of Atlanta called Gainesville, Georgia. And I've been here, like I said, for 10 years. I did my training at Duke Neurosurgery. And yeah, I basically do the gamut of all general neurosurgery, including spine and cranial work. But mostly my focus in my practice is spine. But I do a little bit of everything.
What made you interested in becoming a neurosurgeon?
I became interested in neurosurgery just by personal experience. I was 13 years old when my mom was involved in an auto accident in the line of duty. She was a police officer and was involved in an accident which left her quadriplegic. She had a C4 burst fracture and had surgery. And just my whole experience going through her injury, her recovery, everything it's like to have a spinal cord injury long term really just inspired something in me to want to help people just like her. It was a really it was a really traumatizing part of my childhood that really brought in light like what life is about and how we can use ourselves to better others. So I think just going through everything with her initially in that time of my life where I didn't really know what I wanted to do was just brought me to neuroscience and spinal cord injury, and I just wanted to help people just like her. So
Going back to when you were in school to be a neurosurgeon, you were med school, then you were a resident. How does that look like? And I guess I'm curious the difference of it, 10 plus years ago when you were in school versus today from what you're seeing, having different maybe like residents work with you or under you. How is the process of being a woman in neurosurgery? Did you find that there's a lot of like different gender roles that are still being broken? That's still like a long way that needs to come for that. What does that process look like?
it was hard. I mean, I was in a program where, like I said, I trained at Duke, and there was no female attendings at the time when I was in training, or even in my medical school when I went through med school and was through the neurosurgery department there. So being a woman was unique. Like I was literally like one of the few. We had two other residents at the time, but that was it. So we didn't really have anybody, that looked like us or had that experience to fall back on. So it was just trial by fire, so to speak. And I mean, it's that I will say that my program and the majority of my attendings were super supported, and I never felt different or unique or out of the realm of normal in my training. So I think just being a woman in a male dominated field just has its challenges. I feel like in some aspects we feel like we have to prove ourselves more just to show ourselves and to show others that we belong to be here. And it's definitely tough, but I think things are changing. I mean, I think so many more women are going into the field. The percentiles are going up. I think there's a multitude of reasons why women don't go into the field. Honestly, it's from I talk about this a lot, but when you're a medical student and you're rotating and you're in that time period where you're trying to feel out different specialties and where might you fit in and what is your calling. I think people that kind of base their career paths based on their experience as a medical student are really at a disadvantage to fields like neurosurgery, because when you go in the room, you're not, I wouldn't say you're not welcomed, but you're different and you don't have anybody to ask. Or it's when you go into a room just in a social situation and you go into a room where you're the only woman in the room versus going into the room where there's everybody like you feel more welcomed and comfortable in your natural, kind of environment. And that's the same in your medical school experience. So I think that those women that really want to do neurosurgery, love neuroscience, passionate about the field, don't see that as a barrier. But then others that, are kind of dabbling their curiosities of interest are not going to necessarily fit in, and that's going to deter them. So I think that's one of the barriers. And then, being a female surgical resident and the requirements it takes in your early 20s and late 20s, and sometimes into your 30s in neurosurgery, that's an important time in our life to where we do family planning and on our personal life. Being in a field where there's such high demands and there's not many women to have that experience, or maybe there's not as many accommodations around family, it's really hard. And I think there are things that we can do to improve upon that. I think there are things that we have done over the years to improve upon that. But for any woman that's highly desires to have a family, those are decisions that we have to make, and they're hard. So
How did that look like for you? I know you have two kids. What did that look
yeah.
like? Were you in residency? Were you in attending already? Like, what did the process look like for you when you were family planning personally?
So I had no relationships going into medical school or residency. Like I was single. I knew that I wanted to have a family, but by no means was I anywhere near that mindset at all. I met my husband in residency in my third year. So I was, at the time, my program was 6 years. So kind of in the middle of residency. So we got married in my fifth year, which was about a year and a half out from completion of residency. So we talked about it, but we decided to wait until I was done, just because multitude of factors of planning, moving, how would we handle a newborn during chief year? We really didn't even. I didn't even think about doing that. So we moved down. I started my new job, and lo and behold, it's not any easier whenever you start your career. So I decided to start trying to start our family about 2 years into practice, just because by that time I was more comfortable in my role and that kind of thing. And so lucky for us, I didn't have any problems with infertility that I know a lot of women that wait. I mean, I was 34 years old, so conceived my son and had him, and it was still very hard, but it was, I was in my own job, I was in my own career, so I could kind of do what I want, and it really didn't affect a lot of people other than the call pool, which my colleagues were very accommodating towards, taking me off the call schedule for a few months. And yeah, my daughter, I had her at 39, so I was geriatric pregnancy, and I'm just, like I said, I'm just very blessed that I was able to have babies at that age, because I know so many of my colleagues, even much younger than that struggle with fertility issues. So if I had to do it all over again, and if I had any recommendations for women going into the field, I would really consider harvesting your eggs early if you don't think that you're ready to have children. Just because when you're ready to do it, and then it can be quite devastating. And like I said, I've gone through that with so many of my colleagues. And one of my really good friends suffered from infertility, and is very passionate about this particular topic. So we've done some podcasts around it and stuff. So I could go on and on about that. But
I know you have a daughter and a son, but speaking of your daughter, you mentioned that you wanted to inspire other women. Do you find that your daughter at 5, has she expressed like any interest, or I'm not, again, I don't have kids, but like at that age, like, is she aware that you're like super badass, like woman in neurosurgery? Like, does she like understand like what you're doing? And is she like, I want to be like mommy? Or like, what is her understanding of what you're doing?
so yeah, my kids really, I don't think have an idea of what I do. I mean, they know mommy does surgery. They know mommy fixes people's heads. I mean, there are times when I'm putting them to bed and then get called in and have to leave. And so we talk about all that, but I don't think that they understand the multitude of really what I do in comparison to what other people do. Not saying that my job is better than anybody else, but it is different, and what we do. But I think my son is starting to realize it more than she is. She's just so young. I mean, I'm still like, the one that gets them dressed, takes them to school, gives them snacks. So I'm no different than any other mom. But yeah, it's funny. I mean, this whole like social media kind of thing, which I know that we'll talk about here soon, is a lot of kids at school talk to them, recognize them, recognize that they're my children, and so people stop me in public to take pictures. So they're starting to like, okay, mommy's different than everybody else. So it's kind of hilarious actually. So
So yeah, speaking of your social media, your Instagram, TikTok, every handle is LadySpineDoc, and I know that you amassed over 1 million followers, especially on TikTok. Why did you take to social media? I feel like it's not typically the standard of, it's a more
neurosurgery.
modernized, it's a more modernized approach for a neurosurgeon to take to social media, but it's grown. I mean, honestly, that's how I connected with you guys, with you as well. It's like, it's
Yeah.
so interesting. So what made you want to do that?
Yeah, I mean, it really happened it wasn't like something I was like, oh yeah, I'm going to go out and be a social media entrepreneur and really, change the game. It was really just kind of, I happened upon it. So I've always used social media for personal uses. I love Instagram, Facebook. I never used TikTok. Absolutely hated TikTok, honestly. My husband was on it all the time, and I'm like, oh my God, I cannot. So, this is during the pandemic, and we were all, obviously bored. We didn't have the ability to do elective cases. I had a lot of time on my hands where I was at work, but like, maybe patients didn't come in. So I utilized my time by watching social media. I saw other people out there, doing things in healthcare, and my PA and I were like, well, let's just make a reel on telemedicine visits. Is actually the first one we did, just to kind of, show people that we offer telemedicine services just on my Instagram following, which is like a couple hundred people. So we did this reel. And then I came home that night and I'm like, I want to do a reel about being a female neurosurgeon. I was actually sitting in this exact spot in my kitchen, and I did this reel. It was not great, but it was just entertaining to me. So I recorded it in the TikTok platform because I was trying to figure out how to do it. The music integration was super easy in TikTok. And then I downloaded it and uploaded it to Instagram. And when I shared it on TikTok, I didn't know that I was public. I mean, I had like 3 followers, and the platform is so different than Instagram at the time. So I'm like, whatever, I'll just post it. But the way the algorithm is, it'll send it out to the depths of the earth. I don't even know. And that video went, kind of viral at the time. It was a couple 100,000 views, which was viral to me. And there's just a lot of feedback about, oh, I've never seen a female neurosurgeon. Wow, this is, I can't believe I found someone like you. And then lots of questions came up in the comment section. And I was like, oh, this is kind of cool. And then Instagram was very popular too. And I was kind of inspired by the comments, and I'm like, what? There's no other neurosurgeons that are doing this. I think I'll just play around with this for a little bit. So I was at the point in my career about 7 years in at the time, and I mean, we get in this kind of itch stages of our career, so I'm like very comfortable doing neurosurgery, and I was like, oh, this is something new. Let's learn about social media. So I started reading about the algorithms and how they work. And so I was like, I'll post every day for 3 months and just find a topic to talk about, and we'll see what happens. And so I did that, and within 3 months on TikTok, I had like 100,000 followers or something like that. And it was just truly, it was just something that I could do outside of my field, that I could reach other people that I couldn't reach the traditional ways, and women that wanted to go into neurosurgery, and um or other, just patients wanting to learn about topics of neurosurgery. And there was no there is a few now, but there was nobody else doing that. So yeah, that's how it started. And then once it started, I really just it's an animal. You really can't snowball stop that.
Yeah, what I found super interesting was the case studies that you started doing, because it took, I mean, I guess, rewind question. How did you pick all the cases that you wanted to focus on? Because what I found interesting about them is that you took these very unique, interesting cases in a wide variety of fields. And that's how I actually found your page, was the first case you ever did on glioblastoma. And you were talking about glioblastoma and what it is. The way you explain it in such like a very easy to understand, like lay's terms, I think that's really interesting for a lot of people that aren't in the medical field. So I guess, like, what
Right.
inspired those particular cases and what made you branch out
I
there?
wanted I wanted to stay true to what the core of my platform is to educate. So I the reason why I even got on there is to educate people about my field. And so I really wanted to keep myself honest, really. By making sure that I still posted about things that were educational. So, what I made the commitment early on was to talk about a particular topic once a week at least. So I could, make sure that I was still educating. So that's how I came up with the Sunday case study. It was like really out of the blue. I'm like, all right, Sundays I have some time. It's right before my week starts. I can like do some research on a topic, delve deep, because these videos do take a long time to create. And so yeah, that's kind of how it started. I just wanted to be consistent. And then I found that the audience, you have to kind of understand your audience. If I'm not when I'm on social media, I am not talking to a bunch of neurosurgeons. So I can't keep it at a level that's way up here, because nobody gets it. And I think people even outside of the field of neurosurgery just don't understand neurology, neuroscience at all. So if I break it down on a level that the public can understand or a patient can understand, there are other providers that are going to understand that too. And so the more I started putting information out, I kind of started learning honestly what kind of stuck, how I could explain things that I do to my patients that would people out there would understand. And so that's why I really take topics that are kind of super complicated and break them down so everyone could understand, because there's so many things in our field. I mean, you could talk forever on all these little tiny diagnoses, and there's not a lot of information out there. And so I just will randomly pick topics just to talk about and kind of develop a case. Early on, I'll be honest, some of my earlier case studies were my patients. And I mean, obviously HIPAA compliant. Now that I've gotten kind of popular, I guess I really try to shy away from using anything related to my patients, and just pick topics and make them into a case, so I can really just kind of be as compliant as possible. I don't want anyone to think that they come to my practice to seek my care, that I'm going to start talking about their diagnosis later. Now, I do have some diagnoses that inspire me. Like if I have a patient with something really unusual, I'm like, wow, I'm going to talk about that this week. Like actually, I think the case I'm doing today, I believe I have a patient that was I've never seen it before. I'm like, oh, I've got to talk about it. And yeah, it's just fun. I think it, like you said, I mean, you found me because of the glioblastoma case I did. I have patients that come to me from places all over the country, just from random cases that I talk about, because no other provider understood it. Like I have a patient that came to me from North Carolina or something that's not super close, because I did a case study on peroneal neuropathy. And he says he went to 3 doctors in his area and no one knew what peroneal neuropathy was. And so, I mean, I did like a 20-minute peroneal nerve release on him, and he's been better. And, I don't know why that, that that he couldn't find somebody that really understood it. So it's cool. It's fun. And honestly, I learn a lot from it too. So I think it
Yeah, I mean,
makes me
that
a
was
little
my next
smarter.
question. Like, has your practice grown because of what you're posting? And it sounds like it has. Just people are coming to find you because they see you on social media. And also, I guess follow-up question to that is how can you keep up with the demand for that?
Yeah. It's my PA's joke. They're like, you've got to stop because people literally think that you're the only person in this country that can do X, Y, or Z. I'm like, I I understand. But yeah, I mean it is grown my practice significantly in a way that I've learned what I should and shouldn't do. It's hard because I mean I don't have the capability to serve more than what my capacity is, and I have had to hire additional mid-levels. My PAs have grown since this whole platform has grown, and I've had to change my practice some. But the crux of what I do is really just maintaining the neuroscience in my community. I mean, I'm here to serve my community. This is my hometown. All these patients that are in my area are my main priority. And I think in spine care and neuroscience care, there's so many things that can go awry. And I mean, their follow-up care is probably arguably more important than what you do in the operating room. So I don't think I'm doing somebody justice by bringing them in halfway across the country and doing surgery and then sending them right back. So I really do try to limit that role and seeing which patients may be appropriate for that, because there's so many providers that can help them with their needs, and I don't want anyone to feel that that they can't get care somewhere else. So I do try to help people um, maybe find someone a little closer. But yeah, I mean I have to kind of limit the influx. I have a scheduler that only handles the out-of-state patients and really tries to filter through them and what's appropriate. I have my like kind of schedule limited to the amount of those kind of patients that we see too, just because there is so much demand and need in my area, and that's really my main focus. So
I know you talk about private practice. I'm curious for maybe, and also someone that's interested in going into the field of neurosurgery, what is the benefit of private practice versus like operating at an institution?
there are pros and cons. I weighed in both. I mean, for me, and I really think it has to do with your experience, going into the field of medicine. Before I went to medical school, I worked in a private practice. I was a medical assistant, I was a certified nursing assistant, I was a physical therapy assistant. So I played so many roles in healthcare even before I decided or before I started medical school, that I really understood what it was like to work in a private practice setting. So that experience I really had that was unique to maybe some other students that never had that. So if you go into medicine never working in anything and then going to residency, you really think academic medicine is the only thing that exists. And going outside of that is not mainstream. And I think in our training, our attendings, they they're in academic medicine. They do think that it's superior. I mean, there are more educational opportunities in academics, but for me, I knew that it wasn't for me. That just type of environment, I won't say it's toxic, but it's different. There's a lot of judging that goes on, a lot of competition, and being in your own practice. Just what I wanted to do was just to go to work and take care of patients and do a good job. And so, not have my chairman, ask me questions or judge me or, have to do a research project on the side. I just wanted to take good care of people. And so I knew that in the role of private practice is really where I wanted to be, just from even before I started my residency training. So I just think I wish there was more exposure to that in residency, so people that don't have the experiences that I had can kind of understand what they're doing, because I do think that there are pros and cons to both fields. And then you get into outside of academic medicine, not in academic medicine, you talk about private practice versus like maybe hospital employed practice. There are pros and cons to that as well. I mean, I think there's a lot of shift towards going towards a hospital employed role. And, private practice in itself is almost going out of the wayside just because it is difficult to run a practice that way. And I'm in a multi-specialty private practice, so we do have the benefit of having multiple providers specialties in our practice to kind of help with insurance negotiations and all that type of stuff. So yeah, I mean, it's each their own. It's a big decision, and you can always change it after after you graduate. And many people go from academics to private later in their career.
How do you manage to do it all? You have 2 kids. You spend your Sundays doing case studies. I mean, how do you find that you're able to balance everything that you do? I'm sure it doesn't come without coffee.
Coffee. No, I don't even know. I just really am a very passionate person, and I think I think it all is what you enjoy out of what you do in your life. So for me, my joys are my career, my kids, my family, and my social media. I mean, all of those things fill my cup in different ways that really makes me happy. And I think for other people, you have to do what makes you happy. You have to do what fills your cup, so to speak, because you can only give so much because people will take. I've really learned even in the past year that I have to say no. Like I can't say yes to everything because I will drive myself into the ground. So I've tried to, take efforts to really dedicate to myself, but it's a lot. I just have a very, chaotic but somewhat balanced schedule to where I'll block out times to do X, Y, and Z, and just and just make sure that that I'm trying to do things for every part of my life. So
How do you
it's
avoid
chaos.
burnout?
I don't know. I mean, again, like I'll some days I'll be super burnt out on, I don't know, work, worked really late in the operating room and I didn't get time to put my kids to bed, or I missed their game. And, then you're like, gosh, I could have done that better, or I could have planned my day a little better, or maybe I shouldn't have scheduled, that case. Or then I'll get burnt out on social media, like, gosh, I have so much to do. I don't have any content for tomorrow. What am I going to do? Um, and vice versa. So I just really like whenever I'm feeling that way, I'll try to internally reflect on why I feel that way and how I can make it better the next day. Because I mean, it's in any career, it's not just in my career. I mean, everybody feels that way about their job and their life. And I think all we can do is try to reflect on why we feel that way and then how we can make it better, and then make efforts to try to make it better, and understand that that's a very normal feeling that all of us go through. And I mean, if it's that bad and it's continuous and it's an ongoing problem that you just can't correct, I mean, sometimes you just kind of have to take a step back and say, why do I really need to be doing whatever that's making me feel this way? I mean, that's all we can really do.
And speaking of the operating room, what do you, off the top of your head, what is the most interesting or memorable case that you've ever had?
There are so many cases that I've had that have really kind of changed me as a person. I can think of a multitude of cases that I think every person's life that we come into and intervene on, some things are very routine and bread and butter, and some things are pretty routine, but you have a complication or something, and some things are just unusual. And for me, the cases that really hit me the most are those cases, the trauma cases, in patients that they're going to do something and then something happens and it really, or a disease process that just completely shakes them. And being their physician at that time and helping them go through that situation is really hard but very rewarding. I think the case that most affected me as a person was a subdural hematoma, which is a case as a neurosurgeon we do day in and day out. But
For those that are listening that don't know what that is, can you explain?
yeah, so subdural hematoma is a bleed between the brain and the skull, and it can be life-threatening. So if you get in, a car accident or a fall and your head gets shaken, you can bleed between your brain and your skull, and that can grow to a point where it can kill you. And if it's not intervened upon in a timely fashion, patients can pass from a subdural hematoma. So it's a neurosurgical emergency in most cases. And that's a case that gets me running out the door with zero time to prepare for a case, and the clock, you're on the clock, and you got to get that patient to the operating room fast, and if you don't, they could die. So I had a patient, a police officer that was actually in the line of duty, that was doing a charity motorcycle. I think it was like I don't know, like some kind of benefit, whatever. And they were coming home from that. So they were all on their motorcycles, and he ran off on some gravel and had a massive subdural. And so his officers were beside him, brought him in. I saw the scan. I was, at the time, it was on a Saturday. So I was taking call from home, went in from home, got him to the operating room, and I didn't know that if he was going to live. I mean, it was a very bad bleed, just taking I walked out to go talk to his family after I did the surgery, and there was just the whole field beside the hospital was full of police officers. There was like
Wow.
30 police officers and his wife, and they were all consoling her. And it really took me back to my mom's accident and what happened with her, because it was the same scenario. Because like I said earlier, my mom was a police officer who had a spinal cord injury, not quite of an emergency like that, but just that whole, it took me back to that experience and unroofed some feelings that I had. And it was just really, it was hard to talk to them and handle my emotions, but still be structured to give them the advice from my perspective as their doctor, that he may not make it, he may not be the same person, and we'll just kind of have to see. And fast forward, he survived. I had to do a decompressive craniectomy, which is where we remove the skull to allow the brain to swell. Another surgery after that where I replaced his skull. So I went through all this recovery process with him and his family, and he went on to be completely normal again and have children after that. So just seeing, that was just, I don't know, it just came full circle for me, and it was just a very cool case. So
Yeah, thank you for sharing. Another question about neurosurgery. Since the early stages of your practice when you were studying versus now, what do you feel like has come the farthest in the field?
wow, there's so much. I mean, when I trained, which was, I graduated only 11 years ago. It's not that long. So just 1 decade ago, I didn't know anything about, we didn't have a lot of intraoperative imaging and navigation for spine. So I actually learned how to place pedicle screws with just X-ray. And now we have like robots that can we can plan our trajectories and just push a button and then, deliver hardware into the most critical parts of the spine that we didn't have then. And it's so cool to see, what technology can do to improve patient safety and patient outcomes, and improve even our stress levels of being a surgeon, and trying to plan a case, and just having that back safety net is really, very, very helpful. And I think it can only improve. And the same thing with in the cranial space and the brain space, understanding the different pathways, having the different imaging modalities to help us navigate through someone's brain, and make their outcomes improved, because we understand more about their anatomy, is just it's super cool, and providing less invasive ways to access different parts of the brain and spine. And then not only that, I mean, talk about neuromodulation and freaking Elon Musk and Neuralink, and what possibilities that may have for the field of neuroscience. Not just that, but just neuromodulation in general, and how we can really, uh, maybe even avoid surgery in some instances to help, or help disease processes that we were never able to help, potentially like paralysis. So it's just super cool time to be in this field and to see. And that's one thing that I think a lot of surgeons need to realize, is that technology changes so much. And if we don't change with the technology, then you're kind of left behind. So I've seen that in some of my, colleagues that maybe don't keep up with the latest technology, or not open to learning new things, that you're not gonna be as good as a provider, able to offer your patients as a services, if you don't really understand what's changing in our field.
Yeah, well, I'm just thinking, like, off the top of my head. I mean, imagine you're a neurosurgeon that graduated and finished everything 60 years ago. And now let's say you're in your 70s or 80s and you're just now learning what AI is. I can't even imagine how crazy of a shift that must be.
Yeah, I had two older partners that were both in their 60s and 70s that, kind of adapted with the technology, one better than the other, but there are some surgeons that just never change and they do their same procedure the same way every time, dated back to, when they trained. And not that that's a bad thing because the outcomes are still good. I mean, if you're good at doing what you know how to do, your patients are still going to benefit, but the short-term benefits or what you're able to offer them may change. And so I think it's really important from a patient perspective too to understand that not all doctors are the same. That's one thing that I really enjoy speaking about too on different topics of medicine on my platform is so patients can educate themselves, because not every no I mean the majority of people that are consumers of healthcare are not in healthcare, and they don't
Right.
know any better. And if you're not an educated consumer, then you may be at a disadvantage of what options may be out there. So if you're having the most routine surgery, let's say a microdiscectomy, one of the most common procedures we do in spine, that's a herniated disc surgery. So if you lift something heavy or injure your back or slip a disc, so to speak, the most routine surgery we do is a microdiscectomy. Well, there are several different ways of doing it. You can do it open, you can do it minimally invasive, you can do it endoscopic. Now there's annular closure devices where you can actually close the hole and reduce the risk of reherniation and potentially save your spine long-term benefits. So, to be an educated consumer, to know what surgeon, just because you go see this surgeon doesn't mean that he or she knows every single one of those options and what's best for you. So yeah, I mean, I think the more we put out there on to the public and social media about being an educated healthcare consumer can only help everybody in the long run. So
Yeah.
that's one thing I love talking about.
And speaking on this topic, like high level, let's say if you had to let everyone listening know, okay, to educate yourself as a consumer, these are like the top 3 things that you should do, what would you say?
Number one is get a second opinion, get a third opinion. I mean, if you are having a surgery for anything, even the most routine surgery, there is no harm, as long as it's not emergency, to go and just bounce it off of somebody else and get their thoughts. And, if you see two surgeons and they recommend the same exact thing, then you would feel a lot more comfortable than, going and seeing two surgeons who recommend vastly different things. Because I think you've got to kind of understand what you're putting when you have neurosurgery, when you have brain surgery, when you have spine surgery, it's something that will alter your life forever. I don't care as simple of a surgery as it could be, there are ramifications for the downstream effects of having a surgery on your nerves. And so, understanding that you're doing the right thing or that you're having the best way of doing it is so important. And then, the other thing that I would mention or would say as number two would be if you have the ability to talk to people that are in healthcare and see the surgeons, don't trust reviews online. I mean, you can go and I can go out and hire a bot to like make me 100,000 5-star reviews. And then you go on Google and look it up and well, she has 575 5-star reviews. So she's good. No, I mean, that's not necessarily a reflection of how talented or the options a surgeon can offer a patient or any physician for that matter. So I think talking to people that are in healthcare, asking your doctor about recommendations. Have you had patients that have had surgery by this provider? Or if you know someone that's in the operating room, even better. I always like my most trusted sources on if a surgeon is good is asking like the surgical techs or the nurses or whatever, like what are their experiences with that surgeon, because what the face we put on outside of the operating room and what actually happens inside may be two totally different experiences. Yeah, I mean, I think lastly, I mean, we all, are just a lot of patients every day that I talk to patients, there's so many people that'll be like, whatever you think, doc, it's fine. And it's like, no, I mean, I appreciate that, and patients put their trust in me so much, but it also makes me very nervous to have someone that's like that because they're not educating themselves on their options. And I don't think that we should blindlessly put our trust into people when there's so many resources out there to help us learn about a particular topic. So those would be my 3 recommendations.
And speaking of resources, what is the top resource you'd recommend? Maybe it's Google, maybe it's TikTok. What would you say if someone's like going to do research on a procedure they're about to have or a situation? Where would you say like, hey, this is where you should search?
There are so many pros and cons to each platform about educating yourself. I mean, putting a topic into Google is helpful because you'll get more reputable resources. I really am a little wary, even though I am on social media, to tell someone to look at social media for that, because the level of misinformation is extraordinarily high, and anyone can get on to any social media platform and spout off whatever they want to spout off. That doesn't mean that's even the truth. And I am victim to that too. I mean, I'm talking about something and then maybe later learn, well, maybe I didn't really say that correctly or whatever. So I would definitely, really, really use caution about using anything that's not from a reputable source on there. There was like a Becker study that just came out about the top healthcare influencers out there, and the majority of them are not physicians. So,
Really?
yeah, yeah. I mean,
Okay.
like some of them were like athletes and Elon Musk and, people that are no healthcare background training on there. So,
Take
you
it with a grain of
really,
salt.
exactly, exactly. I mean, not saying that those sources aren't necessarily educational. So, I mean, I think just kind of going out there and doing the best research you can online and using sources that are backed by reputable institutions like, Cleveland Clinic, Mayo Clinic, they have such good basic resources online. Even YouTube has good videos on there, but again, you have to really trust the source. But there's just, I don't know. I mean, I could go on about, online resources and our lack of education of things on there. But yeah, I mean, you just kind of have to delve into different options, and it's okay to make a list and ask your physician about it. Like, hey, I looked at this. What do you think about this? And if they, I mean, it may be totally irrelevant. At least you've asked the question. And
Well, Dr. Betsy Grunch, thank you so much for joining me on this episode of Glioblastoma, aka GBM. I was so fascinated to hear about what you're doing, the experience that you've had, and the effort that you're putting into social media to help educate people in a very unique and interesting way. So thank you so much for your time. And for anyone that's interested, I will link the information to your social media below if they want to get in touch with you or your practice. But yeah, thank you so much for spending your Sunday morning with me.
no problem. Thanks for having me. This was a good conversation. I enjoyed it.
Thank you for tuning in to another episode of Glioblastoma, aka GBM. To learn more about the Glioblastoma Research Organization, you can visit us online at gbmresearch.org, on Instagram or Facebook at Glioblastoma Research, on Twitter at glioblastoma.org, or on LinkedIn as Glioblastoma Research Organization. To start your own fundraiser, to donate, or to learn how to get more involved with the organization, please email us at contact@gbmresearch.org, and we'll see you on the next episode of Glioblastoma, aka GBM.